Hello. We're live at the APA annual meeting with my main man, Dr. Tony Collada. How are you, bro?
I'm good. How are you, Mena?
I'm good, man. So we were just chatting about something that I think is an incredible topic because there's actually an APA caucus on religion and spirituality. There was a wonderful session that happened earlier looking at the partnership with the APA's foundation. There's a wonderful resource that they have, which is a guide for faith leaders. And then we've got an incredible doc who just also wrote a book. Congratulations.
Thanks, Mena. It's very kind of you to say.
Of course, man. So tell me more about the book. You said you were writing it because you wanted to bring out sort of the spiritual and psychiatric principles that you found in Scripture. Tell me more about it.
So I'm a psychiatrist. It's my formal job. I'm also very passionate about the Christian faith and the life of the Old Testament characters. I think we can learn a lot from. It can be inspiring, help us to persevere. And so I do have a book out on the life of King David and his life, almost in like a novel format. Just to try to learn some lessons from his life so that if we're going through difficult times, if we're struggling, we could look at his life as an example to help us persevere. So it's out on Amazon. And if you Amazon Anthony Collada MD, it'll come up KELADA.
Little promo.
Yeah, and so I have another second book working on, sort of similar format, because I have heard good feedback from this other one. So yeah, Christ is the true healer, and just trying to get that message across.
I love that, man, because we were doing even a panel earlier with athletes, and a lot of the athletes were talking about that faith has been an integral part of their own spiritual journey. And so many people right now, as a theme for this meeting, right, that is lifestyle and mental health. Sometimes that incorporates exercise or movement or meditation, but for many people, it's your faith journey, right? And when you can use that in a way that becomes a big part of your own healing, that goes a long way. And for a doc like you, who has academic psychiatrists, your teaching residents, and you can draw out the wisdom from sort of ancient wisdom, biblical wisdom, and have that for patients. What's the feedback been like from patients? How have they sort of received the integration of faith and mental health in their life?
I mean, I think it's important. Patients can see that that's an important source of health and healing. And so a lot of times that will encourage them to get more in touch with their spirituality, with their religious community, and so forth.
And that's consistent with the data, right? There's over 5,000 peer-reviewed studies that have shown this positive impact of faith and mental health. So when you can tie that in on a personal level, drop it in a book and put it in narrative form, on a character like King David, who, let's be honest, like, my man has been through a lot. He's someone who's really relatable as somebody that you could see yourself in. That show on Netflix, right, on the life of King David, was one of the top, along with The Chosen. So there's a phenomenon of interest, I think, for patients. So big shout out, Dr. Tony Collada. Check out his book. Make sure to get on there. And thanks for the APA's foundation for really prioritizing this as a resource. If you're not familiar with this resource on the Guide to Faith Leaders, we're now up to the second iteration of it. There's been 2 versions of it. I've used it when I spoke at churches, and folks have said it's been a tremendous and helpful thing. And it's encouraging for us as psychiatrists to know that the APA and the APA Foundation is incorporating both faith, spirituality, religious practices onto how we can help our patients. So we appreciate that a lot.
Thank you, man.
Appreciate you, man. All right.